Hi everyone, this lesson is on what to avoid if you are taking statin medication. So we're going to talk about certain foods and beverages and medications you want to avoid if you're taking statins because they may increase your risk for getting statin side effects. We're also going to talk about some supplements that you may want to try that may help reduce the risk of side effects from statin medications. Let's first briefly talk about what statin medications are, and then we're going to get into some of those things you want to avoid. So statins are medications used to lower or reduce blood cholesterol levels, and they all have the suffix statin, so we can think of atorvastatin, rosuvastatin, simvastatin, and they inhibit synthesis of cholesterol via inhibition of HMG-CoA reductase enzyme. And they may cause a variety of mild and or severe side effects, as we mentioned previously in 2 other lessons. If you want more information on those side effects, please check out those lessons. And there are certain patient characteristics that increase the risk of having side effects. These include being female, being older, so anybody greater than the age of 80 is at an increased risk, medical conditions, so if a patient has medical conditions like kidney disease, liver disease, or hypothyroidism, which is a low thyroid functioning, they all increase the risk for getting statin side effects. So it's important to check liver and kidney health and thyroid functioning. And then also having a smaller body habitus. So being thinner is also another risk factor for getting statin side effects. Now, the topic of this lesson is that there are other factors, including some things that you eat and drink, that increase or decrease the risk of statin side effects. So that is what we're going to talk about in this lesson. So first, we're going to talk about what increases the risk of statin side effects. So the first one is alcohol. So statins can cause hepatitis or liver inflammation and liver damage. So we've talked about this in previous lessons, but statins can lead to liver inflammation and damage. And drinking alcohol, especially heavy alcohol consumption, can exacerbate this liver inflammation and liver damage. So although it might not increase the risk of statin side effects, it will be an additive effect on the liver. So it's better to avoid alcohol consumption because statins and alcohol can both lead to liver inflammation and liver damage. So it's again best to avoid or at least limit alcohol consumption when you are taking statins. Now, an important food to avoid when you're eating statins is grapefruit. So consuming grapefruits and or consuming grapefruit juice is something that you want to avoid if you are taking statins. The reason being is because grapefruit inhibits the metabolism of many medications. It inhibits certain enzymes in the liver, and these enzymes are responsible for metabolizing many medications, including statins, which can lead to higher serum levels of statins. So because of this, there's going to be a higher level of statins than there should be, and that higher level is going to lead to increased risk of side effects. So it's important to avoid eating grapefruit and avoid drinking grapefruit juice. Now, there are certain medications that can lead to increased risk of side effects from statins. These include other cholesterol-lowering medications. So other cholesterol-lowering medications, if you are taking this along with statins, this can lead to an increased risk for side effects from statins, and they increase the effects of each other. And an example of these other cholesterol-lowering medications are fibrates. So fenofibrate is one example. Taking antibiotics can also lead to increased levels of statins and increased risk of side effects from statins. So particular antibiotics that do this include the macrolide antibiotics, so azithromycin and erythromycin, when used with a patient who is on statins, appears to increase side effects and mortality. So it's very important for your primary care provider to think about this when prescribing these medications. Macrolides appear to inhibit P450 enzyme, which is an enzyme in your liver that is responsible for metabolizing statins, essentially, again, leading to higher statin serum levels. So similar to the mechanism of grapefruit, macrolides also inhibit the metabolism of statins, leading to higher statin levels. Antifungals are another class of medications that can lead to increased risk of statin side effects. So antifungals, like the azole medications, so these medications have azole at the end of their name, they can inhibit or impair liver enzymes that metabolize a variety of medications, including statins. So again, these azole medications, so fluconazole is one of them. If you're taking that, it can inhibit enzymes in your liver that metabolize statins, leading to increased levels of statins in your blood and increased risk of statin side effects. So again, an example is fluconazole, or ketoconazole is another example. Warfarin is also another medication that can interact with statins. So warfarin is a vitamin K antagonist used to decrease the risk of blood clotting. And most statin medications appear to interact with warfarin through warfarin's ability to inhibit CYP3A4 metabolism. So again, this is a very important cytochrome P450 enzyme that metabolizes the statins. So it's CYP3A4. And again, most statins are metabolized by this enzyme. However, from studies, it appears that atorvastatin is the exception here and likely does not interact with warfarin. Heart medications can also lead to an increased risk of statin side effects. So some heart medications, which we'll talk about here in a moment, lead to increased levels of statins through various mechanisms, efflux transporters, and decreased statin metabolism. And some of these examples include amiodarone, verapamil, and diltiazem. So again, as you can see, there's a lot of similar things going on here with all of these medications. A lot of them lead to inhibition of metabolism of the statins, leading to higher levels of statins. And this is the reason why we see an increased risk for statin side effects. Cyclosporin is another medication that can lead to an increased risk for statin side effects. Cyclosporin is used in treatment of some cases of rheumatoid arthritis and psoriasis. And again, cyclosporin inhibits CYP3A4 enzyme, leading to decreased metabolism of statins. Again, statin levels increase because of this. So you can see a lot of these medications are inhibiting that CYP3A4 enzyme. And in particular, what has been found with cyclosporin more specifically is that using cyclosporin with statins increases the risk of myopathy and rhabdomyolysis, or degradation or breakdown of muscle. And then because of all of this, it's not surprising that polypharmacy, which is just taking a lot of different medications, increases your risk for statin side effects. So we talked a lot about different medications that can inhibit the metabolism of statins, but there are many others that could also even slightly decrease the metabolism. And if there's multiple medications, that can lead to an additive effect. So polypharmacy, again, is taking many prescription medications. And this may also occur with other medications, including over-the-counter medications and herbal medications. So if you're taking a lot of prescription medications, over-the-counter medications, herbal medications, they can all interact. They can all cause inhibition on some of those enzymes in the liver that metabolize statins. So again, this is all likely due to increasing possibilities of drug interactions. One medication decreasing or inhibiting the metabolism of statin medications. So the more medications that are used together, the more risk there is for one of these medications to inhibit statin metabolism. So this is why polypharmacy, or taking many prescription medications and many other medications, can lead to increased risk of statin side effects. Let's talk about some supplements that may actually decrease the risk of statin side effects. So one of them is coenzyme Q10. This comes from the review article entitled, "Does coenzyme Q10 supplementation mitigate statin-associated muscle symptoms? Pharmacological and methodological considerations." So it has been noted that statin medications can lead to lower serum levels of coenzyme Q10, and coenzyme Q10 is known to be important for mitochondrial functioning. So it is possible that decreased coenzyme Q10 levels may be the possible cause of statin-induced myopathy. So myopathy, again, is that ache and pain in the muscles, and even rhabdomyolysis, which is that breakdown or degradation of muscles that can subsequently lead to kidney injury and kidney failure. Now, the evidence here is mixed. Some studies suggest that coenzyme Q10 supplementation may help. Some studies don't seem to find that relationship, but it could. So supplementing coenzyme Q10 with statin medications may help reduce the risk of statin side effects, especially statin-induced myopathy and rhabdomyolysis. And then another important supplement to take if you're on statin medications is vitamin D. And this comes from the article entitled "Vitamin D Serum Levels in Patients with Statin-Induced Musculoskeletal Pain." So it has been found that insufficient and or deficient vitamin D levels are associated with an increased risk for statin-induced myopathy and rhabdomyolysis. So it's important that vitamin D supplementation be taken if patients are taking statins, because if they are deficient, they're at an even higher risk for getting statin-induced myopathy and rhabdomyolysis. So vitamin D supplementation is very important. And there are certain lifestyle modifications that can also be employed to help reduce the risk of statins. One is avoiding or limiting rigorous exercise. The reason being is because rigorous exercise, especially very rigorous exercise, can increase the risk for rhabdomyolysis. And if statins are already increasing the risk of muscle injury and rhabdomyolysis, it's better to avoid or limit rigorous exercise. And it's also important to limit the number of over-the-counter and herbal medications. So we talked about this before. If there is polypharmacy, so taking a lot of medications, this is going to increase your risk for statin side effects because the chances that one of those is inhibiting statin metabolism becomes higher and higher the more medications and herbal medications you're taking. So if possible, it's best to try to limit the number of over-the-counter and herbal medications. So if you want to learn more about statin side effects, please check out my lessons on those topics. And if you haven't already, please like and subscribe for more lessons like this one.